So welcome to the slit lamp tutorial. Today we're going to talk about how to use the slit lamp here at the VA Boston Hospital. So here is my patient, and first thing you want to do is make sure that the patient is comfortable and seated appropriately and seated upright. And before you start, you're also going to want to make sure that they take off their spectacles, take off their glasses. So can you please remove your spectacles for me? And so when you have the patient seated, first thing you want to do is make sure that the machine itself is nice and clean. So first you're going to take an alcohol wipe and you're going to tear it open, and you're going to make sure that all of the surfaces that are going to be making contact with the patient's face are going to be nice and clean. So you just want to take an alcohol wipe, rub down the chin area and the forehead. And just to expedite the process, you can take a tissue as well. Get that dry, just so the patient doesn't have anything wet touching their face. Now you're ready to approximate the machine to the patient. So first thing you want to do is make sure that the machine is not locked, and swing it across the front of the patient and approach them in a slow manner, making sure not to hit their knees or their arms in the process. The first thing you want to do is make sure that the elevation of the machine is appropriate. So you want to make sure that neither you nor the patient are uncomfortable. So what you can do is there's a clasp right here on the lower right side. It's a clasp that you can press in, and this will raise or lower the machine appropriately. So when you're seated towards the patient and when the patient is nice and close to the machine, you can have them place their chin on this chin strap. How does that feel for you? Okay, please back up. There you go. And try again. How does that feel? One thing that I want to talk about next is the proper elevation of the patient's head and the how to set the bifocals on the actual machine. So as you can see, there's a line here on the machine, and that indicates the elevation of where the eye should be. So there's a knob right here that can lower and elevate the patient's head. So you want to make sure that this line is approximated with the patient's lateral canthus. Here you have the binoculars that you're going to be looking through to evaluate the patient. You want to make sure that you start at the 0 mark for both and adjust them to a comfortable level to get a clear picture through the scope. Just below the stand of the machine, we have the power and light intensity knobs. So the first thing you want to do after you get the eyepieces aligned, you want to flip on the switch, but before you do so, you want to make sure that the power is on this lowest setting, just to make sure you don't blind the patient. When you first start using the machine, it should be in a locked position. So this knob is the locking mechanism. So you want to turn this counterclockwise to unlock the machine, and you'll be able to freely move the base of the machine. And there's basically two types of movements. There's macro movements that kind of move the entire machine along the wide base, and there's micro movements using just the joystick to make smaller, finer adjustments to the machine. There's also a capability of lifting and lowering the microscope. So you can lower the microscope by turning the knob counterclockwise, and you can lift it by rotating the knob counterclockwise. And you'll be using a combination of all those movements: the macro, the micro, and the lifting and lowering of the scope to get the best picture possible. The best hand movement or hand placement to have is to have your right hand on the joystick and to have your left hand on this knob right here. This knob right here controls the width of the light, and it's a little bit hard to see here, but once you get to experiment with the light a little bit, you'll be able to widen the beam and to narrow the beam into the slit, which the machine is known for. So when you're looking through the microscope, you're going to be trying to get the best picture of the eye possible. And one way you can do this is by adjusting not only the position of the microscope, but also the light that's entering the eye. And as you can see, the light and the beam is mobile, and it's on this mobile arm. And you could move the arm and adjust the angle by swinging the arm back and forth across the plane of view, and that will help you get good angles to evaluate both gormless structures in the anterior segment. And so once you see the eye through the microscope, and lock onto a target, one thing that you can do is touch this knob right here, and this is the magnification knob, and you can adjust it to 10, 16, and so on until you get the desired magnification. So once you get oriented to the machine, basically you can play with it and just keep practicing so that you can get good at really evaluating the structures of the anterior segment as well as all the adduction structures like the eyelids and eyelashes and everything in between. Some other things that you can start to play with once you get really good at evaluating the structures on a basic level, you can start adjusting this knob, and this knob actually can determine the length of the beam of light. So if you turn it all the way clockwise, you can get a blue light, which is very useful for the fluorescent staining to evaluate for corneal abrasions and corneal injury. So there you have it. That is a brief tutorial about how to use a slit lamp. Just keep in mind that it will take a lot of practice. There's a lot of moving parts, and it'll be a while before you get used to all the hand movements again. But it can be fun, and